Chlamydia is a special organism in all of the microbiology, which is that organism that causes sexually transmitted diseases. Now, this organism is an obligate intracellular organism, meaning that it cannot live outside the cell. It has to grow inside the cell in order to replicate or provide a different sort of function by using the protein synthase pathway of the cell. So, apart from that, it has a rigid cell wall, but it lacks a typical protein glycan layer that is present in a lot of gram-positive and gram-negative bacteria. But it resembles gram-negative bacteria because but at the same time it lacks muramic acid, which is present in such bacteria. Now, a special thing about is that it has a specific lipoprotein saccharide, which helps for its detection by complement fixation. Now, its life cycle of this sexually transmitted disease is that it starts as an extracellular body, which is known as an elementary body. This is a spore which is metabolically inactive. As we have discussed that it cannot replicate outside the cell, it has to get into the cell in order to divide. So what happens is when it enters any sort of cell, especially the epithelial cells, now this converts into a reticulate body. Now this reticulate body is able to take this protein synthetic pathway of the cell, and similarly it divides by binary fission, meaning that if it is 1, it will divide into 2, and that 2 will give off more babies, and similarly they will replicate. Now this is binary fusion. It's like a fusion like pathway which will spread and spread and spread. Then again, this reticulate body is converted into elementary body in order to go out into more epithelial cells and do it all over again. Now, this chlamydia has various type of genuses. It consists upon the following organisms: Chlamydia trichomatis, which causes conjunctivitis, trachoma, and also responsible for causing STDs. Apart from that, we have another organism which is Chlamydia pneumoniae, which causes pneumonia, obvious. And we have lastly Chlamydia psittaci. Chlamydia psittaci is causing of pneumonia, but its transmission is not through aerosol. Instead, it is by infected birds. The people who are dealing with, they inhale such aerosol from those birds, and similarly they get pneumonia, but this type of pneumonia is known as Chlamydia psittaci. Now, trichomatis consists upon a lot of serotypes that cause a lot of different types, because as we know, some cause conjunctivitis, some would cause trachoma, and some would cause STDs. Approximately there are 15 immunotypes which cause different types of diseases. They are designated as A, B, C, D, E, F up to L. Now, A, B, and C are responsible for eye manifestations. Eye manifestations, what are? They would form trachoma formation, which would restrict the eyeballs movement. They will also cause conjunctivitis, would be reddish inflammation of the eyes. Now this is done by A, B, and C. Now next thing is that D and K cause specific genital tract infection, which is a non-gonococcal type of urethritis. In men it causes epididymitis, prostatitis, proctitis. There are inflammation of the various parts of the men genital system. Now it consists of epididymis. There will be epididymitis, prostatitis, inflammation of the prostate, and proctitis. In women, what will happen? There will be inflammation of the salpinges. Now the salpinges will be inflamed. This would result in salpingitis, and if this infection extends outwards out of the fimbriae, this would result in a disease known as pelvic inflammatory disease. If the salpinges are infected, later on the salpinges, when the inflammation subsides, the fibrosis occurs. So in similar, what happens in these patients, they have a lot of problems with fertility after salpingitis has been over, so it is also leads to infertility. Now, if certain mother who has Such genital tract infection give rise to a baby. After 12 days after delivery, what happens to that is that the baby develops mucopurulent conjunctivitis. The baby would develop what? Mucopurulent conjunctivitis. The eye would be so sticky and so red. There would be a lot of pus coming from the eyes of the baby, which is known as mucopurulent conjunctivitis. Now, the last immunotypes L1 to L3 calls lymphogranuloma venerum. This is a STD lesion which is formed over the genitals as well as over the lymph nodes. Now, what is this? Lymphogranuloma venerum is STD lesions forming over the genitals and the lymph nodes. Now, what happens next? Now, this C. trichomatis is also associated with a specific syndrome which is known as the Ritter syndrome, which consists upon a triad of diseases, meaning that the patient would have urethritis, would have arthritis, and would have uveitis, meaning eye symptoms, joint symptoms, and urethra would be infected of the patient. Okay, so this disease is associated with the Ritter syndrome that is accompanied with arthritis and uveitis. The person would already with C. trichomatis would have urethritis, but if the joints get infected and the uvea get infected, so this would be turning into Ritter syndrome. Now, what are the specific labs we do? Now, we take the epithelial cells, and what we do is that if the urethra is infected, we will take the urethra, we will do a pap smear or something, smear that will take some cells from the urethra, and we will grow them. Now, by doing so, by putting it on we will look at it under a microscope, and we'll see inside these epithelium cell we will see cytoplasmic inclusion bodies on gymnostain. Now, this will help us give rise to a few elementary bodies or reticulate bodies by which we will diagnose it. And apart from that, we can grow this organism or identify this organism by fluorescence antibody staining, which helps into identification that this organism is present within that epithelial cells. And we can also do hybridization DNA probing test for identification of this organism. Apart from that, we know in urethritis, urine would also be infected, or if there is skin lesion present, that epithelium is infected, there will be exudates form on it. So we can do antigen detection by the using ELISA or NAT, which is nucleic acid amplification test. Similarly, we will find antigens of the chlamydia in these exudate and urine, and similarly would lead to a diagnosis. Apart from that, we do a culture. We grow it on a medium which is treated with chlorohexidine, heximide. Now, what it does, it will inhibit all the other cell activity, and it will only cause chlamydia to grow. And the special thing about chlamydia that it differentiates from other trichomatis would differentiate it from other types of chlamydia, that it contains glycogen inclusions. When this glycogen inclusions are treated with iodine, we can similarly see these bodies over it, whereas Psittaci and Chlamydia pneumonia does not carry these glycogen inclusion bodies. That helps to differentiate between when grown upon a culture. Then what is the treatment? The treatment of choice for C. trichomatis is azithromycin, whereas treatment of choice for Chlamydia psittaci and Chlamydia pneumoniae is tetracyclines. That includes doxycycline, macrolides, erythromycin, or even azithromycin.